In this video, we will discuss the anatomy of plantar fasciitis. The plantar fasciitis affects primarily the plantar fascia. The plantar fascia is a fibrous sheath of connective tissue that is a continuation of the Achilles tendon, where majority originates from the medial tuberosity of the calcaneus, where it is at its thickest, and it runs to the ball of the foot, splitting into the proximal phalanges of each of the 5 toes, becoming progressively thinner. The plantar fascia can be divided into medial, central, and lateral components. The central runs forward and blends with the fibrocartilage in the metaphalangeal joint and the deep transverse intermetatarsal ligament. The lateral slip spans to the base of the 5th metatarsal or styloid process. The plantar fascia's 5 original slips then split again just below the metatarsal shafts, with each slip generating a superficial and a deep, totaling 10 slips to the metatarsal heads and inserting into a complex network of the plantar forefoot area. The deep slips insert into the flexor aponeurosis of each respective digit. The 5 superficial slips attach into the deep fascia of the transverse sulcus, a groove formed by the plantar aspect of the bases of the toes. Some fibers of the plantar fascia attach to the flexor digitorum brevis, a muscle lying underneath the fascia, which is contained within the first layer of the foot, along with the abductor hallucis and the abductor digiti minimi. The other areas can be affected by the plantar fasciitis include the second layer, which includes the quadratus plantae and the lumbricals. The third layer can also be affected, and it includes the flexor hallucis brevis, the adductor hallucis, and the flexor digiti minimi brevis. Plantar fasciitis can even affect the deepest layers of the foot, the 4th layer, which include the dorsal and plantar interossi. Irritation to the nerves can also present some of the areas, can present with pain in plantar fasciitis in some of the areas. Some of the nerves include the posterior tibial, the inferior calcaneal, the medial plantar, and the lateral plantar. Baxter's nerve, also known as the calcaneal can branch off the lateral plantar or directly from the posterior tibial nerve to affect the calcaneus and the heel pain associated with plantar fasciitis. Plantar fasciitis can also be affected with the fat pad of the heel, which may be a contributing factor to plantar fasciitis.